Hello, welcome to Globalsportscare. I've got a good friend of mine today with me, Dr. Theo Marin. Theo has a special interest in regenerative medicine and is an orthopedic surgeon in Caracas. Hi, Theo.
Hello, Markus. Thank you for the invitation. Hello to everybody. I hope that this answers a lot of your questions and also bring you some other thoughts in mind.
Good, thank you, great. So I wanted just to have a quick chat about does PRP work in knee osteoarthritis? Can you tell us what the research currently says and what I, as a patient or even as a physician, need to look out for?
Well, this is a very interesting question. Actually, stating that PRP works on knee osteoarthritis is still very controversial. Okay, there is a lot of evidence on PRP in knee osteoarthritis. I mean, there are tons of papers published. However, the quality of them is not the best, and thus stating such a thing is still difficult. However, there are several papers with a high quality that states that PRP can have a very good impact in terms of pain relief and improving function in knee osteoarthritis. Considering that the evidence is still quite controversial, there are some societies such as ESCA, the European Sports Orthopedic and Knee Surgery Association, that they have done a very good expert consensus stating that PRP is a good option for knee osteoarthritis.
Yes, and did they also speak about what factors you need to look after, or is it any PRP that works?
Okay, that's what I meant by controversial when referring to the evidence on PRP. The main issue with research on PRP is that PRP is an umbrella term that is used to define almost any kind of blood-derived product, okay, that has been centrifuged. However, there are a lot of factors that need to be taken in consideration in order to say that this is actually PRP. And one of the main complaints that I personally have with the research on PRP is that the product that most of the researchers and healthcare practitioners are using are not clearly defined, and thus it cannot be replicated in most of the cases. Okay, so there are several factors that need to be considered when using PRP in knee osteoarthritis. One of them is the PRP dose. Okay, it's not only the concentration with this, which is important, but also the dose. I mean, the absolute number of platelets that are injected on the osteoarthritic knee. The second would be what is the leukocyte concentration, or is there any leukocyte in the formulation? Okay, but in short, as a rule of thumb, I would recommend that if you are using PRP, you need to withdraw at least 60 ml of blood. That would be my recommendation.
And is there something known about what the ideal dose is? Is there a too little or a too much?
Okay, this is still controversial. Okay, there are less than a dozen of studies that actually report an adequate platelet concentration. Okay, it seems that there is a dose-dependent effect on PRP dose and its effect on the symptom relief and function improvement on knee osteoarthritis. I would say that the minimum optimal PRP dose should be 7 billion to 10 billion platelets. And these can be spared in just in a single dose, or it could be in several doses. Okay, it seems that it has an accumulative effect. So you need to aim for 7 billion, maybe in a single injection, or maybe in 3 injections, or 10 billion. However, in most of the studies, the PRP dose is undisclosed or is less than that, unfortunately.
Yeah. So that's, I think, why the controversy about PRP continues, as we don't know what we are usually injecting. Yeah. And
yeah, and also in terms of leukocyte composition, right? Some of them are, some of the studies are stating that leukocyte may play a detrimental role in osteoarthritis, contributing to the cartilage degeneration, and thus leukocyte poor preparations should be preferred. But again, there are studies that also contradict that. So leukocyte presence in the PRP composition is still controversial.
Yeah, but you would say there is no, as it currently stands, there's no real or good evidence to use either or, so leukocyte rich or leukocyte poor.
Yeah. Yeah, I think that platelet dose might be a more relevant factor. And if I can reach that platelet dose with some leukocytes in it, I wouldn't mind. Yes. Because it seems that the platelet, the effect is dose dependent in terms of platelet concentration and absolute dose.
Yes. So in summary, basically, you say, okay, PRP is controversial, mainly because over the years, our research has not been good enough to actually determine a dose and what actually works. But putting all together, PRP might have a good effect on function and pain scores if you use a dose of about 7 billion.
Yes, yes, that's right, Markus. And I will add an extra comment just to spice it up. When people ask me if they should have a PRP injection for knee osteoarthritis in their knee, I always answer that it depends on who's injecting the PRP, okay? Maybe in hands-on practitioners that are not aware of these kind of details when performing PRP injections, I would advise a hyaluronic acid injection rather than a PRP injection. Because if we are injecting a suboptimal dose, probably it's better to have another product injected on the knee with a disclosed dose and composition.
So if a patient is basically lying in his doctor's surgery and is having a PRP injection and they're only taking 15 mils of blood, would you say maybe that's not the best PRP, and ask the patient to ask his doctor, should I have more blood taken?
Yes, I mean, as a rule of thumb, if you are using a PRP system, it should have at least 60 ml in each blood draw, okay? If you cannot do that, maybe it's better to use in your practice anything else. You have a lot of other options, including injectable implants, hyaluronic acid, even steroids in some cases that will cost less and give better relief compared to a suboptimal platelet injection, PRP injection.
Would you even go as far, and that's my last point, to say that if you have a PRP injection where you take 15 mils of blood, which I have to say a lot of colleagues use, that this is similar to placebo?
I would say that it's better in that case to prepare 4 of those injections, okay, and do it Otherwise, it seems that it will take several sessions, I mean, several injections. Maybe weekly, you will need more injections that you should, and I think that it's not worth the price. Okay, yeah. I wouldn't. I mean, the time when this kind of devices with 50 mmL were useful had passed a long time ago. So it's better to move on according to the evidence and give to the patients a better treatment option.
Great. So as a summary, get at least...
As a summary?
Get at least 60 mL of blood to make your injection worth the effort of the doctor and for the effect of the patient. Thank you very much, Theo. I think that's very useful for all of us to know, and I hope to see you in the next video where we might be discussing what possible side effects of PRP there are. Thank you.
That's great, Markus.